Hi everyone, welcome back to Therapy Tip Tuesday. My name is Amanda and today my quick therapy tip for us will be about feeding. So when I refer to feeding, I'm actually referring to picky eaters. And you might be surprised to know that we do see a large amount of children who are considered picky eaters. With a very limited dietary repertoire or aversion to certain foods. And here at Ally Speech, we use the SOS approach, or the sequential oral sensory approach to feeding. And this is actually based on a hierarchy of tolerance, which is really cool. So you start with the least amount of tolerance and then you build all the way up to the most. The least being having the food on the table in front of you, just being able to see it, you're not touching it, you're not interacting with it, and then the most being touching it, bringing it to your mouth, chewing it, and swallowing it, because that's our goal when we work on feeding with picky eaters, is to introduce new foods into their diet, whether it's for nutritional needs or just to get some more variety into their diet, to try, to taste, to see if they like, it's okay, it's bad, and then we can move on from there. Sometimes feeding sessions can be a little bit scary for some clients because their aversion could be pretty severe. They just might not have a really great experience with food for whatever reason. Maybe it could be they lost control while they were trying to chew. Maybe they choked on something one time and now they're scared to ever try that again. Whatever the reason is, we make sure that during our sessions we are not ever forcing anyone to try something or participate in the hierarchy at a level that they're not ready for. So, a really fun and interactive way that you can work on feeding at home with your child is with this handy dandy worksheet. And this is cool, so I'll explain it really quick. And I've found that putting it into some type of sleeve or laminating it is even more helpful because you could actually put foods on it and you don't want it to get dirty. So we see at the top we have numbers here, and that's where we can use little chips, or it could even be little goldfish or Cheerios, whatever it is. But we have different sections here, kind of the same thing as the hierarchy. So we have, I can see the food, so that would be the lowest level of tolerance. I can hold the food, we're increasing here. I can smell the food, we're bringing the food closer to the face. I can lick the food, we're introducing the food to the mouth, but not past the lips. I can hold it in my teeth. And then this is where it gets fun. We have an ant bite, a dog bite, or a crocodile bite. Crocodile bite might be a little too big, so I don't think I've ever used this, but dog bite, ant bite, and you could also always use your own made up type of bite depending on what your kids like. It could be a dinosaur bite or it could be a unicorn bite too, which could be fun. So we have this really cool sheet that we can show to our clients, you can show to your kids, and while you're eating, you can have your tokens if you want, or it could be goldfish, it could be Cheerios to help count the number of bites that you take. And you could introduce or initiate the meal by asking your child, okay, what type of bite should we start with today? Do you want to start with an ant bite? Should we start with a dinosaur bite? And then you could ask them, what do you think an ant bite would be like? Do you think it's really, really small or really, really big? And then they'll tell you, and then you can help them actually to show them how much food they should be taking in at one time, just to make sure it's not too much and also to make sure it's not too little, and ask them to take their ant bite, their dinosaur bite, their unicorn bite, whatever it is. And then they can put a token here all the way up to 10 if that's your goal. It could be 5, it could be 3 in a row, whatever it needs to be at whatever type of meal of the day. And also something really cool is food descriptions on the back, because sometimes talking about food can be a little difficult as well. But we have different colors and shapes, feeling, smell, and taste. Talking about food while we're eating it could actually bring down the anxiety around food, because we can see, we're talking about color, about shape, the feeling of it, the smell of it, the taste, it still involves your child or our client in the meal. They have some time to explore it. They can talk to you about it. You can tell them an experience that you've had with a certain food. You can talk about similar colors to a different food that they do like, or a shape or a feeling. And instead of them being nervous about trying the food, they can get excited about just talking about it, and then talking about it will build on that positive experience that they have around the food in general. Something else really helpful that I actually use with my clients sometimes are games where you can feed another animal or a person. I play a game on Pink Cat Games where some of my clients can feed a unicorn or a dinosaur or a robot, and it's helpful because they can feed the character, and then we can take our turn and they can take a bite of their food at whatever level that they are comfortable at, whether it's licking it, whether it's bringing it to their lips to give it a kiss, whatever the tolerance is at the time for that type of food. But it makes it fun, it makes it silly, it makes it something that they look forward to. A lot of my clients always ask me, oh, are we gonna feed the unicorn today? Of course, we can feed the unicorn. Let's do it. And now we could talk about it too. We could talk about what our unicorn eats, we could talk about what we eat, and then we could use our tokens along the way. All right, well, that is the end of my little quick feeding therapy tip for today, and I hope you enjoyed. I hope this is helpful. The next time that you have a meal with your picky eater, if you have a picky eater at home, and I will see you next week. Bye.